This is Z. Z is a Cocker Spaniel, and Z is here for an annual exam. Included in that annual exam is his physical exam by the doctor, a heartworm test, which also we test for Ehrlichia and Lyme disease, which are tick-borne diseases, and we test his stool for intestinal parasites. And then we vaccinate them for appropriate vaccinations that they are due for. So we are going to draw for a heartworm test, and we just need 3 drops of blood, and we usually go from their leg, cephalic veins. The test is actually testing for antibodies within the blood. So we gotta wait for the well to fill up. And then once we do, we snap it. It takes about 8 to 10 minutes for the results. You'll get a positive control. And then we're ready for the doctor's exam.
We're going to do an annual exam on this. Is a Z, a Cocker Spaniel, 6 years and 9 months. Came into us today, and we just kind of note what we're going to do once a year for him. Seems like a pretty good little dog here, and I always approach them kind of slowly, make sure they're not going to bite me. You don't know if they do, so they're going to tell you whether they're going to bite you if you watch their ears and their tail and just how they look at you. So be cautious in approaching any animal, of course. So we'll talk real fast. We'll kind of, what we do with our exam, we go from head to tail. Try to go to every system and make sure it's normal. I do the same exam. I've done it for 23 years, so that's probably 20,000 exams. So we'll just kind of approach this thing the way I do. So, making sure that his nose is normal. Here's a good dog. There's air coming out both nostrils. There's no discharge, no swelling. You're looking at his eyes. You can kind of see, if you can kind of come a little closer here, Hank. You look at his eye here. You see this is a third eyelid. See that little bump right there? It's called a cherry eye. And they're actually called, it's a nictitans flap, so he has a prolapse nictitans. And it's a normal abnormal. We can fix this by tacking it down. It doesn't seem to be bothering this dog, like causing conjunctivitis or irritation, so that's an abnormality. We can maybe note that in a future video, so just for the shortness here. The other eye, opportunistically, can you get it closer on that one? You see the cataract there? Cataract in Latin means waterfall, and you can kind of see that little hazing of the lens on that side. I mean, hazing of the lens. You can see the little cataract. Cataract surgery can be done to fix that. There definitely is going to be a little bit of reduced vision. See how I'm doing this? Watch my hand. See, he's blinking without wind touching his eyes, so he definitely has vision, but he might have a little better vision in this eye, because this one he's looking through a shower door, if you will. So again, we'll know cataracts a little bit later. So let's see how his teeth look. And I'd say ugh. You see the tartar build up on those, on these. This is all calculus, the big plug of calcium and bacteria on his teeth. And if we leave these alone, he'll get gingivitis. See how there's a little gum recession on this bottom. If we don't clean those teeth, we're potentially going to have to remove that tooth. Good dog, good boy. This side maybe a little bit better, but you see, same thing. We got a lot of tartar on those teeth as well. So he definitely can use a dental. So far we can fix his eye, take his cataract, fix his prolapse, nictitans, and do a dental on him. So that's just his head. See how, well, the Cockers have a lot of ear problems, and the way I kind of do it, I just kind of put my nose down there. It's kind of gross, but if he doesn't have a lot of odor, certainly, grab my otoscope, please, right over there. I'm going to look down in his ear. He's had ear infections before, and a lot of Cockers do. A lot of Spaniels do anyway. It's not just because they have long ears. They have a lot of allergies, food allergy and pollen allergy. His ears actually look pretty good today. There's not a lot of odor in him. He's not shaking his head. He's not painful when I'm manipulating his ear. So that's nice. They may just do some flushing on there to try to keep those clean and dry. So that's good. Hey, Gunny. So let's look at him from above here. If you can kind of flash in from above. I like to get them standing, but I want to see if they're overweight or normal weight. Okay. I put my hands in on the ribs and see if I can feel the ribs, and I can on him. If he's standing up, hopefully he has a little tuck in his abdomen. Want to stand up? It's okay, buddy.
Baby.
All right, so let's see how he looks here. You think he's overweight? Let your hand go here. So no, I think he's good. See, I have a little tuck here. I can feel his ribs, and he's good weight. Really important for him. So next thing I'm doing, I'm just putting my fingers on his femoral pulses, and they feel nice and normal. He's got good pulses here. That's just like on the inside of his thighs, kind of like, getting our pulse off our wrists. So listen to his heart here. It's okay, buddy. Yeah, so he actually has a little murmur. Here's another, real quick thing. A lot of dogs have murmurs. We're not worried about them necessarily. We follow them along. And it's his mitral valve, which is on his left side. We're hearing that regurgitant flow. When his valve's closed, the fluid runs back through it. So you hear that venturic effect. So that's what that murmur is, a swishing sound. So, once again, we'll do a video later on that, but it can lead to congestive heart failure later in life. It may be benign. It may never cause them a problem. It could be cardiomyopathy. You could have heartworms. Mostly they just have valve deficiencies, and that generally does not cause any problems until a little later in life. His coat looks really good. I don't, see any hair loss. It's smooth and glossy, which is nice. That's good. I don't, if I push back his hair, I don't find any fleas on him or irritation. So I think, of course, you always kind of look under their tails, kind of gross, but it's to make sure that everything is normal back there, and palpate all his other parts, and they're good. I flex and extend all his joints, make sure he's not, lame or limping. I'll get him out in the parking lot and run him up and down, make sure he's not limping on something. Make sure he's looking at his toes and toenails, make sure he doesn't have any growths in there, and they're actually good size, good length. Long toenails can lead to lameness and disfigurement of their ankle and their little joints and their toes as well. When I'm kind of falling back here in his abdomen, I'm making sure that his abdomen feels normal and I don't feel any masses in his abdomen. Sometimes I'll push my hand in here and feel a big spleen or a bladder problem, or a big kidney. His right kidney's right here and his left kidney's right here. The back of his liver is here and his spleen is sitting right here. They're all normal. His bladder is normal as well, so that's nice that he's not painful, has normal organs. So that's a real quick exam. We certainly have a lot more thought in, but I want to do a short video for you. Head to tail, found abnormalities, just he's got that third eyelid prolapse, he's got the cataracts, he's got gingivitis, a little chronic ear thing going on, not so bad today, and a heart murmur. So I'm going to type this all out on a report and give it to the owner. Thanks.